Informed consent is a second form that must be completed and signed before a MAP may provide any assistance with medication for an APD client. Like the authorization for medication administration form, informed consent must be completed and signed every year. You also need to be sure a copy of the consent is in the MAR book at each location he or she receives medication assistance. Remember, the client or his legal representative may withdraw their consent at any time. Be on the lookout for the people who are permitted to sign the informed consent for medication administration, how often the consent must be completed and signed, the places where there should be a copy of the consent, and who is permitted to be a witness to the execution of the consent. The client's name for this example will be Jessie James. Jessie is able to give consent, and her doctor determined that she will need assistance administering her medications based on the authorization we completed in the previous lesson. Below are the steps to complete the form. 1. Fill in the name of the person who will be giving consent, Jessie James. 2. Fill in the name of the provider or agency employing the MAP, Best Agency Incorporated. 3. Check, administer, or supervise as indicated on the authorization for medication administration form. 4. The name of the client, Jessie James. 5. Client or legal representative signature and the date. 6. Printed name of the person signing and the date. 7. Signature and dates of 2 witnesses. 8. The date the informed consent expires. A quick recap. To provide any assistance with medications, you must have a current and signed authorization for medication administration and informed consent for medication administration forms. Both forms must be completed at least every year. The authorization must be updated if the client has a change in his or her medical condition that has an impact on their ability to manage their medications. This could mean they need either more or less assistance. The people in the doctor's office that write prescriptions may sign the authorization, MD, DO, PA, and an APRN. The informed consent is signed by the people who are permitted to authorize medical treatment, the client, his or her guardian, or legal representative. The person giving consent may withdraw their consent at any time. The MAP may not give consent. However, the MAP, provider, or other staff may act as witnesses.